All right, Salim Razaya here, and I want to talk about a trial that just came out, and it's involving traumatic lacerations that present to the emergency department. So this is the paper right here, and basically these authors were looking at the use of non-sterile gloves and drapes compared to sterile gloves and drapes. Now this is a fascinating trial to me personally because I have always thought that when these injuries come in, they're already contaminated. And so I always thought once you irrigated the wound that the use of sterile materials was a bit superfluous. So here's the clinical question these authors were trying to answer. Is the use of non-sterile materials, gloves, dressings, and drapes, non-inferior to sterile materials in the rate of wound infection after suturing traumatic lacerations? So what did they do? So this was 3 emergency departments in the Netherlands. And this was a non-inferiority randomized clinical trial, basically comparing non-sterile gloves and drapes to sterile gloves and drapes. Now, these authors set an inferiority margin of 2%. So in other words, if the difference was less than 2%, then the use of non-sterile gloves was basically about the same as using sterile gloves in terms of wound infection. Their primary outcome we already alluded to: wound infection 5 to 14 days post-procedure. And the critical results. So there was about 1,480 patients that got randomized. And here's what they found. 6.8% wound infection for the use of sterile equipment versus 5.7% for non-sterile equipment. The difference is less than 2%. And so non-sterile gloves and drapes was non-inferior, about as good as using sterile gloves and drapes. So a couple of limitations that are worth mentioning. So first of all, the trial got terminated early, and it was something about incorporation of primary care doctors into how they triage patients. And so the recruitment of patients actually started dwindling, so they opted to stop the trial, which means, unfortunately, it wasn't exactly powered correctly based on the statistics that they crunched out. The second thing that I think is worth noting here is that less than 5% of these patients had diabetes, were on chronic steroids, or immunosuppressed. And so we have to be careful extrapolating results to these populations. So the clinical bottom line of this study is the study suggests, although underpowered, there was no difference between sterile versus non-sterile gloves and dressings in the suturing of traumatic lacerations. But be very cautious extrapolating these results to patients with diabetes, on chronic steroids, or who are immunosuppressed. So there you have it, non-sterile gloves for suturing traumatic lacerations. Let me know your thoughts, comments, and questions, and until next time.